Hi, I'm Dan Lessard from Health Sciences North. Any hospital is going to tell you that the number one concern is patient safety and quality. But did you know that as a patient or a family member, as a visitor, there's simple things that you can do to promote patient safety and quality? And we're going to get a quick lesson in that today from Jeanette Mallet, a nurse clinician here at Health Sciences North. Hey Jeanette, thanks for joining us.
Oh, thank you, Dan.
Now what Jeanette and her team have done is set up a room of medical errors, and we're going to show you some simple little things that you can do to promote patient safety. But you have to know what you're looking for. So Jeanette, you have this typical room set up. Can you just walk us through some of the potential safety hazards for a patient that are on display right here?
Okay, Dan. In a typical room, in this setup, we have a number of errors that are very obvious and some that are not so obvious. The ones that patients want to be most concerned with are things that they can assist the staff in pointing out or keeping themselves safe. One of the main things that we promote here is to ask if you don't know, and to certainly question the staff if you need to find out any information. So it's important that a patient has a role in safety, and you will see that around the hospital in posters encouraging patients to do so. In this case, you might notice over the patient's head that he is fasting for a test, and yet, if you look to the side, somebody has delivered a food tray to him here. In that case, the patient could actually request that the food tray be taken away, certainly if they know that they can let people know about those sorts of things. There's medication left at the bedside that hasn't been taken. That presents itself as a hazard. If you had a visitor who came in and possibly another patient who got a hold to those meds, that would be an issue. There's open containers of hand sanitizer, which present a risk if it's ingested or taken in. If you look at the patient who's sporting a cast here, we want to remind people that although it's itchy, using things like a tongue depressor are not appropriate to scratch an itch. There are creams and lotions. If we go around this side, you can also see that the patient setup the patient is on a stretcher, but the side rails are down, and the side rails provide a measure of safety if the patient is not completely aware, is not going to roll out of bed and cause harm. There are slipping hazards on the floor, so the patient could be involved by asking housekeeping if they could clean that up, or request that the nurse find someone to clean it up. There are other things in the environment that present a risk, obviously, to the patient. They're not as obvious. Some of them are the chart that you see here should never be with the patient unattended because it presents a risk of confidentiality breach. And that's a big thing now in healthcare, that patient's information remain confidential and only within the circle of care, and that's the immediate care providers. Any of the equipment here that doesn't function or appears to be malfunctioning is another reason that a patient can ask, that they check the equipment. And one of the biggest things that we promote is hand hygiene. And patients aren't always aware that they can challenge their healthcare providers. I'm sorry, I didn't see you wash your hands, or have you performed hand hygiene? And we don't consider that an inappropriate request. Obviously, we want to ensure that we're compliant with such issues. If we're coming within the proximity of the patient's care, we should have performed proper hand hygiene. And when we do touch equipment or perform procedures, we should be washing our hands in between. So these 4 points of contact include coming into the room, before you do a procedure, after you perform it, and when you leave the room. And these hand hygiene points are very important. We report those to the ministry. These are things that the government wants to know that we're doing our part to lower hospital-acquired infections, which can be a big risk to a patient. So that's one of the biggest things that people can do. Did you wash your hands?
Simple things that you can do to promote patient safety if you're a patient, if you're a visitor, or if you're a family member coming to see your loved one in hospital.
Yes.
Jeanette Mallet, nurse clinician at Health Sciences North, thanks so much.
You're welcome, Dan.
We hope you've enjoyed this presentation of the room of errors so that the next time you're in hospital, there's simple things that you can do to promote patient safety. If you'd like to learn more about patient safety, even being involved as a patient or family advisor, visit our website, hsnsudbury.ca.